Assalamu alaikum. Topic of my talk is clinical judgment and decision making. I am Dr. Feroz Ali Kaloro. I am professor of operative dentistry and endodontics. Currently, I am working as a dean, faculty of dentistry, Liaquat University of Medical and Health Sciences, Jamshoro. I am thankful to my organizer of this conference, Asia Pacific Dental Federation, and Pakistan Dental Association. They offered me this opportunity to share my thoughts. So thank you so much. Clinical judgment is actually the ability of the clinician to make a decision regarding the treatment options, selecting the better treatment for his or her patient, and no doubt that decision making abilities depend upon his or her experience, clinical experience, his knowledge or expertise. So this is so important in clinical practice. In this presentation, we briefly discuss and we learn what is the importance of this, this clinical judgment and decision making skill in your practice, and how can we enhance it. So there are some clinical situation we come across in daily in our practice, some we that require to make the decision. For example, here a doubtful pulp status. There the deep dental caries involving your coronal tooth structure so close to the pulp. Decision to make the to save the pulp or to remove the pulp, to go for root canal treatment. The root canal treatment, selecting the root canal treatment, no doubt, is most time consuming, more even the uh, uh, prognosis of the tooth with the root treated as compared to normal tooth is less. So that selecting should be scientific based, and it should be in the favor of the patient. Sometimes situation could be challenging. For example, another example, when there is a doubtful tooth structure, compromised tooth, whether you decide to remove the tooth or to retain the tooth, periodontal problems there, tooth structure loss is there, but then deciding, we have nowadays a dental implant are available, which is a good option, and deciding the tooth should be replaced with implant or should be retained. Okay, so things sometimes not so easy to decide. Failing root canal, again, it's challenging for endodontists to go for non-surgical retreatment or surgical endo, or sometimes it's better removing and replacing this. These clinical situations is, here again, a single visit versus multiple visit protocol. A single visit is no doubt popular, and more than 90% now practice a single visit, but it has limitations. Sometimes cases then needs to make the decision. Let's go for a single visit, or sometimes it's a multiple visit protocol. So your clinical judgments actually the cognitive process of forming your diagnosis, making choices of the treatment, and predicting the treatment outcome. These things are relevant to each other, and they influence the each other. So you have to be very careful at each step to decide correctly. Protocol of clinical management, starting from diagnosis. You make the diagnosis by collecting the data, clinical data, investigations, your examination history, and all that. You're making diagnosis. After making diagnosis, you are planning the treatment, and that planning is so important because there is a list of the option available, and that list you have to select one, and that I suggest that the patient should be involved in that, selecting that particular option for the patient. You are selecting it. So this is here your this skill to decide is important. Then executing needs your the technical skills, your expertise, and then prognosis. So before importing the treatment, and you should know the outcome of the treatment. So for diagnosis, at least you should know the answer of these three questions: what, why, and what. First, what is the problem? Detect the problem. What is actually problem? Then detect the cause of the problem. So if the problem can only be solved when you know the cause of the problem, and then the prognosis when you are planning the treatment for the problem, then you should know the, as earlier we discussed it, that the prognosis is important before treatment. So do not render the treatment until you find the answer of these questions. Clinical judgment could be valid if it is based on science and evidence. Okay, the science evidence are available, just check it, and is your what we call the evidence-based practice or evidence-based dentistry. Intuitive is experience-based. Experience, no doubt, so important, but experience without knowledge or without current recent knowledge is sometimes, very dangerous. Could be dangerous with experience with knowledge without knowledge. So for example here, just in before 15 to 20 years, it was routine practice that at the first root canal appointment, the excess cavities were left open. So because they believing that there's a, you know, this is the right protocol, but it was not right protocol. But they were doing, and they believe that this is the correct. So doing and believing that we are what we are doing is correct, sometimes it could be not correct. So you have to check, you update your knowledge. That is important. Biased clinical judgment can, unfortunately, it can happen, and that is so dangerous. And when you are putting your interest, you're keeping your interest over the interest of your patient, and there are multiple factors behind it. Could be financial one, that you are selecting the treatment option which give you more financial benefit, and sometimes is you are specialty driven, that you, for example, implantologist may have a more, tilt towards removal and replacement, as compared to endodontists which have, or periodontologists which have more tilt towards retaining the tooth. So this could happen, but it should be avoided and should not happen in your practice. So it must be in terms of protecting and restoring the human well-being. Is your clinical, is decision making, it should be, patient centered. Its treatment choice should be patient centered. So because some factors may affect, you may have a ideal treatment, but some patient factor may affect, and then you have to select the alternate one. For example, patient with some medical health issues, undiabetic, uncontrolled diabetes, and so common in our setup, and patient having on medicines, you have to select alternate options, age related problem, or patients have some financial issues, you may have to select some other options for that patient. So treatment related technical factors, for example, an endodontics, if there is a mouth opening problem where you can't apply the rubber dam, all these issues, sometimes in these issues, then we need to select alternate options. Okay, or implantologists, when there is a chances of the, damaging the inferior alveolar nerve in the mandibular posterior area, you may have select and other options. So there are factors other, as we discussed, that experience, intelligence, even fatigue of the clinician may affect your treatment, um, or decision making ability, mood even. So you have to be very, fresh and all that when you are taking some critical decisions. So clinical judgment can be developed, is a skill, and a skill can be developed with practice. Okay, so that is important, and practice gives you the experience, or experience, practice, experience, both is we can, but that your practice and experience, when you are critically analyzing it, that is so important. That's how it develops, scientifically. And then feedback is important. Feedback from your patient, from your colleague, from your or seniors, from your juniors, all you have. If you practicing this feedback, this is so important for growth. reflection, reflecting your own work. Okay, you should have a record of your previous patient, and then when same patients coming back to you, you should check the treatment which you have did, and the outcome on prognosis and mistakes, even some. So discussion feedback from the colleague, even from the other specialties, you have to, for example, if you are endodontist, you may discuss it with the periodontologist, with the implantologist, with all that, your colleagues to, before treatment or even after treatment, you may have discuss it with. Knowledge should be updated. It's so important, as we discussed, that your practice should be evidence based, and how you enhance your knowledge, your continuing medical or dental education, attending the workshops, attending the hands-on the conferences are so important, and the reading the scientific literatures publications are so available now. These meta-analysis, review articles, all that will be helpful in deciding the treatment options on which is better. But information nowadays is much available nowadays, but much disinformation and misinformation is also available. So be careful for from this fallacious and malicious data. This there is the Latin phrase what we is pro hoc ergo propter hoc, meaning uh, after this uh, after this, and therefore because of this. So these kind of data is available, and this data could be misleading and misguiding you. So you have to be careful from this uh, malicious data, that the experiment should be present in your study observation, and your comparison should be there between. There should be two more than two groups. There should be that is the control group should be there. Randomization, clinical trials, randomized clinical trials are better to follow. This is the best. For example, there is the studies available on the success and the failure rate of endo. Success and failure rate of endo and implant. So mostly these studies say that the success of implant is better than endo, or somehow they are equal. And on following these studies, we select that some why not for implant? Why we go for endo? It's was hectic, time consuming, fatigue process. So that is scientifically based, because the study said that success is better. Implant has better success, but you have to go to check other things as well. What for example, here the adjunct additional treatment, which is more in implant as less in endo. There the additional when bone grafting and all that surgical procedures more are required for implant than endo, and the number of appointments are more in implant and you know less in endo. Time for final restoration in endodontically treated to you go over restoration within days, but for final restoration of your implant, at, sometimes you go for months even. Prescribed medication is more in implant, and no doubt cost is more in implant. So this is not how you taking these studies, how you getting these your literature is important, that it, it should not be misguide or mislead you. In short, keep yourself self updated, but be careful from your fallacy. Multidisciplinary approach is highly helpful. Always discuss it with your colleague and with colleague of other specialties before treatment, selecting the treatment, and keep the patient interest always on top, because the ultimate goal of a clinician is the well-being of the patient. So thank you so much for providing me this opportunity. Thank you and listening me.